The best reward that I would get is if I know my patient was on 6 medicines and after 6 months I was able to bring it down to 5 and 4, maybe even 3 medications. That would be a reward for me. I mean, that's what we should be focused on. That should be our target. And over the years, I think we've lost the true meaning of health. And so we need to go back to WHO, World Health Organization, in the mid-40s defined health. And I feel like that is probably the best definition of health even today. And they basically said it's not merely the absence of disease, meaning a patient can look physically healthy. They can look great. They weigh perfect. BMI is perfect. Muscle fat ratio is great. But the reality is, maybe there's something brewing. Maybe the labs are starting to creep up. Maybe if we can take a look at what's going on inside, we will see that there may be a disease that's going to erupt over the next weeks, months, or even years. And there may be a time that we can stop this pattern. And the only way to do this is to get quarterly labs.
This is going to be so cool. You're being so brave. I'm going to show this to your brother and sister, okay?
There you
Look,
go.
you didn't even cry.
Are we done?
I didn't feel it at all. That's really good.
A 25-year-old comes in for the first time to a clinician's office to establish a relationship. So as a routine, we would get baseline labs, and the baseline labs would include an A1C, and that's the standard of care, to put in a marker that will be a pre-diabetic screen, obtaining an A1C. That's what the standard of care is. However, it's an absolute myth that A1C is a predictor of diabetes. It's actually designed to evaluate the compliance of medications and diet once the patient has been diagnosed with diabetes, not to make a pre-diabetic diagnosis, because A1C is a measure of the RBC function and the amount of sugar that's on the RBCs. And the RBCs in our blood only last for about 90 to 120 days. It's a fallacy and a false satisfaction to the patient to say my A1C is okay, because it's only a 90-day indicator. What we should be measuring, what is optimal diabetic care, would be to obtain the insulin level. Why? Because you want to go to the factory where the insulin is generated, and pancreas is where the factory is. So if we can see the function of the factory, if we can see, is the factory getting tired? So if you produce a lot of insulin over a lot of weeks, a lot of months, a lot of years, eventually it's going to get fatigued. So that's what we want to see. We want to see the fasting insulin level on a quarterly basis, and to see if there's a increase or a rise in the fasting insulin. If there is, now that's an indicator to say, wait a minute, the factory where insulin is produced, which stabilizes the blood sugar, which is an indicator for diabetes, is getting tired. So what does that tell anybody? Over time, it's going to eventually get tired. We need to look at the labs, and that is a precursor. That's an indicator of what is to come, or what is one expecting years or months down the road. So getting labs at least annually as a bare minimum is what everyone should be focused on, and that should be our target or our goal, to get annual labs. In fact, one should even look at doing labs every 90 days or every 120 days, quarterly labs, essentially to understand what is going on within and look for signs of early diseases. Quarterly labs would probably be optimal to engage a patient to see if there's any trends, because no disease creeps up overnight. You weren't healthy yesterday and got diabetes today, or you weren't healthy yesterday and got cancer today. It was a gradual process over weeks, months, or years that we could have picked up if we had routinely performed labs on a quarterly basis.